You want to do 5? And we will be access. The Department of Health will use this week to do the following. Recognize the progress made to reduce many vaccine preventable diseases that have caused death and disabilities to children worldwide, such as measles, rubella, polio, whooping cough, and tetanus. We will sustain the gains achieved by having our infants and children vaccinated according to the Bermuda Childhood Immunization Schedule. Awareness of Vaccination Week in the Americas and immunizations to promote vaccination as an effective means of combating childhood diseases, and will develop strategies for building confidence in vaccination focused on community stakeholders. Like the rest of the world, Bermuda has been living with and managing the COVID-19 pandemic for over 2 years, and our COVID-19 mass vaccination program was key to our success in managing this pandemic. Now that we have moved into living safely with COVID-19, we must focus on sustaining the gains of Bermuda's vaccination program through increased coverage of routine vaccinations and by growing awareness. Bermuda's 2020 extended immunization report indicated a decreased uptake in routine vaccinations in comparison to 2019, when there was a sustained increase in coverage compared to 2018. For example, rotavirus vaccines in 2017 was 72%. In 2018, it was 75%. In 2019, 87%. And in 2020, it fell back to 83%. Last year, a survey on public confidence in immunizations was conducted, concluding that there is great confidence in immunization as a health measure, generally for preventing many diseases. However, the analysis also revealed there are some decreases in that confidence in immunizations in the vaccine approval process for emergency use and health agencies involved with vaccination. We noted emergency use vaccination was a major player in forming vaccination views. Recognizing a need for renewed confidence in vaccinations, we will seek to build awareness among the population while involving the key stakeholders, targeting local groups, and encouraging peer-led education on vaccination. Immunizations have been successful interventions to save lives locally and globally. It is important to note that Bermuda is a major travel destination, and as such, it is at increased risk for the importation of COVID-19 and many other vaccine-preventable diseases, such as diphtheria and whooping cough. There are critical implications and risks associated with Bermuda having increased risk for immune compromised patients who cannot vaccinate, and potential impact on people like infants and children, seniors, and women. Other risks include the impact on resources tackling disease outbreaks, lower health as a country. This would be an excellent opportunity for everyone to get up to date with their vaccination. Vaccination Week in America's 2022 here in Bermuda, and they will include telehealth mascot Army Jeremy, along with Broadway this morning and on North Shore Road tomorrow, waving to bring in the celebrations. Look out for and join Army Jeremy's dance walk Wednesday, 27. There will be a number of informational and educational communications from the Department of Health we'll be sharing throughout this week. We invite parents and the general public to visit our health centers for updates on vaccine products. Register to get COVID-19 vaccine if you've not done so already, and get boosted if you are eligible. Plenty of reliable and credible research has proven time and time again that fears about vaccines are unfounded. Evidence makes it clear that, unfortunately, the complications from vaccine-preventable diseases are worse than people generally believe and may not be worth the risk of not being vaccinated. Remember, vaccines work. Against in closing, I would like to now turn to Honey and the team for a pre-recorded message from Mr. Ian Stein, who is the Bermuda and Cayman Islands. Thank you.
Thank you, Mr. Apologies, I don't have any volume. Let's cut it again. Sorry.
Ministry of Health, members of the President. It is my pleasure to join you for the kickoff of Vaccination Week of the Americas and to bring greetings on behalf of Dr. Carissa Tien, the Director of the Pan-American Health Organization, and the Office of the Americas for the World Health Organization. A major event in our region's calendar. It's a key driver of immunization progress, and an illustration of what can happen when countries work together across national borders to improve their population's health, and specifically to eliminate vaccine preventable disease in the Americas. Through the commitment of parents and hard health workers, we've eliminated polio, measles, rubella, congenital rubella, and neonatal tetanus. However, we have for polio, measles, rubella, diphtheria, and childhood diseases had been found. The pandemic exacerbated these trends with increasing vaccine hesitancy linked in part to contributed to emerging including the reestablishment of immunization program in the Americas is the perfect opportunity to reinforce the efforts that we know work and to find creative new ways to advocate and maintain focus on immunization. Let me take a moment to commend the government of Bermuda and the Ministry of Health on their sustained promotion of vaccine and your recent strategies 2022 to 2020 in our region for 70% of your population ahead of the target. This target was described by Dr. Chin she noted that the kind of infection is proof that vaccines are working well to protect people from hospitalization and death due to COVID-19. This, ladies and gentlemen, is is guided by the Immunization Agenda 2030, which address challenges related to immunization over the next decade. We will continue to review immunization coverage and surveillance of vaccine preventable diseases, and technical advice to address gaps in senior hard-won public gains. We will also continue to vaccine to meet the growing demands of the Ministry of Health participation in regional health priorities. Regional meetings of measles and syndrome. On a final note, this year is 420. On this we will celebrate 100 years of active health work, collaborating with and supporting the countries of the region to improve the health and well-being of the populations. For celebrations, we will check access as we work to recover after the recommendations on the launch of Vaccination Week of the Americas 2022, and remember to get all your shots. Thank you.
Thank you. Thank you, Mr. Steve. Now, the Q&A, and I and thank you. We'll start questions with Catherine, President of the Broadcasting Company. Welcome, Mr. Steve.
Good morning.
Catherine, thank you. We can see you.
Good morning. Thank you for your comments. I guess you noticed Bermuda has reached its 70% vaccine target against COVID-19. What do you attribute this to?
Thank you for that question, Jasmine. Actually, I want to attribute it to the hard work and effort of the team twofold. One is the hard work the team here is to help through their education, their commitment, working long, continue to operationalize our vaccination strategy, the educational aspect of informing the nature and importance of vaccination. On the same time, I have to thank the public for holding the mantle and making sure that they do what they can to not only protect themselves, but to protect their community by taking responsibility to assist with respect to us mitigating against COVID by the immunization program that we have.
If I may add to that, actually, if I may, good morning. I want to say the government in this respect, because I think we see a number of challenges for many different places to reach this at this stage. So it's a testament to the hard work you mentioned, Minister, of the many different people that are happy, very well engaged on this, both community leaders as well as within the public health service. So these levels are a tribute to that tremendous work.
You mentioned a lot of challenges in terms of vaccine hesitancy. Apart from campaigns, I understand that people probably never really on board on the vaccinations. Do you think that can change?
So I think initiatives such as this help to raise awareness to members of the public and to our stakeholders of the importance of immunizations, the fact that they do work and and there's proven evidence and scientific backing to support that they are a valuable asset that is in our arsenal to prevent many deaths and other childhood diseases. I think it's also important for us to continue recognizing that, regrettably, to quote Dr. Miller from the hospital, Dr. Google doesn't know what is best. And the reality is that there is, as Mr. Stein said, a lot of fake information and fake news in the population right now. And regrettably, the internet does help to spark it. We've always happened for the last several years. They need to speak to their medical practitioner, rely on Dr. Google or information that's on the internet that unfortunately is not necessarily its accuracy, and then a lot of is included. But again, initiatives like this will continue to help to raise awareness, and the team is committed to working with our stakeholders and members of the public to help them to recognize the importance of vaccinations and the fact that they actually do work.
And again, if I may just supplement that, I think that we also recognize that the vaccine hesitancy and people who are perhaps have a very strong attitude, I think that's a challenge for us, right? But it's not a challenge that we're dismissing. That is to say, we look at this in the long arc of history, and we know that immunization vaccines work effectively. They're one of the most effective public health tools that we have. And so what we see, these groups of persons who have learned their information from a variety of different sources, is a challenge for us that we're up to the task. Right? We have to find new ways to engage with those people, to share the right information that resonates with them, so that they can also move to something that is an evidence-based approach. And so we must recognize that it's a new challenge for us that has emerged over the past several years, and the pandemic has heightened this. And so it's a challenge that we have to take as well.
Thanks for that. Just a question of the measles. There's been a you mentioned, how big is it in our region to make up in terms of what's being done to address it?
Hi, Jasmine. I'll yield to the technical team where we have not only.
Thank you.
I'll yield. Thank
you. I'm hoping my internet connection is stable. I'm on a separate device in case it's not working effectively. So I look to you to guide me if you're hearing me well. So measles is a challenge for many reasons. One is there have been several outbreaks over the past several years in several different countries throughout the hemisphere, from Venezuela, United States, Canada. Seen research to this, and because measles is exceptionally contagious. The COVID pieces that have been on the issue of contagiousness of viruses, measles is in the very high. So we can't take these issues around measles very lightly, because we do see as health systems been challenged to keep routine immunization up. We see in many different places measles and other vaccination rates going down. And so because of the very high contagiousness of that particular affliction, we recognize, and the potential for serious negative outcomes, it's a big concern for us. We've been successful in tackling this in many different places, and so with this profession and good surveillance, is able to beat this back issue. However, we're up to the task to be.
Thank you. And just to Minister, okay, obviously there's a lot of other viruses going around, not COVID-19, but I wondered how the flu vaccination uptake been comparable to previous years in terms of people's willingness to not only be vaccinated against COVID-19, but as well as the flu shot this year.
I actually know the stats on that, but I am joined by Jackson, who is the Chief Nursing Officer for the Department of Health, who will be able to provide further details with respect to the stats. Thanks, Jasmine.
Thank you.
Thank you. And good afternoon, everyone. Actually, we had a relatively, thank you. Good afternoon, everyone. We had a relatively good uptake regarding the immunization for influenza, particularly the year before with the threat of COVID, it was greater. It was still actually, the uptake was very good last year as well. So we had perhaps almost 5,000 doses administered through private sector as well as through our Flu Express and annual Flu Express. So it's a really important one that the public is very receptive to as well, and they continue to be receptive to that.
Thank you. I think that's it for me. Thanks very much. Have a good day.
Thank you, Jasmine. Thank you very much. We'll now have questions from Fiona McWhorter of the Royal Gazette. Here she is. Okay, apologies, Fiona's camera is not working, so we will only have audio from Fiona.
My apologies. Good morning, everyone, and thank you all very much for your time. I just wanted to start something that has been touched on already with regards to vaccine hesitance. Minister or Mr. Stein, are you saying that there is hesitancy to routine vaccinations that has been a direct result of some concerns and fake information with regards to the COVID-19 vaccination?
I'll yield to Mr. Stein, but Fiona, we have seen in Bermuda, as I indicated some of the statistics previously, where we had some immunization for various diseases where we've seen a decline. For rotavirus, for example, in 2019, we were at 87%, and in 2020 at 83%, whereas it was at a higher percent previously. So we have seen somewhat of a decline with respect to, just a minute, sorry, a decrease in the uptake of routine vaccinations compared to 2019. Part of that, as Mr. Stein has rightly indicated, has been probably as a result of some of the fake news and the information surrounding the COVID vaccine. But I can yield to Mr. Stein to provide a little bit more background with respect to what is being seen in the Americas. Thanks, Fiona.
Thank you, Minister, and thank you for the question as well. So if I may try to take this up, this is a complicated matter, is the short answer, because there's many factors at play, and some of which we understand and some of the ones that are still unfolding. So let us take this one piece at a time. We understand, we have seen across many different countries in the Americas that routine vaccination rates have been going down steadily over the past many years. And there can be a number of different reasons why this is the case. It could be greater vaccine hesitancy, it could be, but it might be other factors as well. And I think that what we have to focus on now is strengthening the routine immunization programs as we emerge from the pandemic and reinforce these systems that we know work effectively. So I think it might be, I don't think it is yet apparent that the reasons for the lower vaccination rates at this time is growing vaccine hesitancy. It could be one of those factors, but that's something that we have to better understand as time unfolds. And so for us, the key message here is we need to reverse this trend. We need to reinvest in these strategies that we generally know are very effective in preventing these diseases.
Thank you both very much. We talked a little bit about routine vaccinations, and while I appreciate that in terms of the history of vaccinations, those for COVID-19 are very, very young, is there any way you can tell us at what point or with what parameters it might be that COVID vaccination would become one of the routine?
Dr. Stein, I'm going to turn it over to Mrs. Stein. Thank you.
A lot of discussion. Thank you, Minister. There's been a lot of discussion about how COVID is going to unfold. I think let's talk about what we know. We know that the COVID virus has been exceptionally clever in finding the vulnerable groups in our population. And at the same time, it's been very clever in creating new mutations or variants that have forced us to keep our guard up over time. There has been some discussion about whether the COVID vaccine would become something that would be a part of our routine vaccination program, such as the flu. However, I think the jury is still out on that. And I think that one of the parts of the reasons why the jury is still out is there still is tremendous progress being made in vaccine development. While there is still where there are many excellent choices of vaccine available to us through the Americas, we also recognize that there are many more that are still going through the research process. And I think we have to see how those hold up over the long haul. We know that the vaccine that we have decreasing over time, so that might mean boosters regularly. However, I think the jury is still out for us to see how these range of vaccines, existing ones, how they will be improved, but they like over time. So I think it's still early to see how that will shake out over the coming years.
That's very helpful. Thank you very much. And the last one I think probably is more so for our Bermuda team. We've heard that the VWA is said to have led to more than 806 million people being vaccinated across the Americas over the past 20 years. Now, admittedly, I don't know the extent to which Bermuda has been involved in this campaign for the past 20 years, but do we have any figures as to the extent to which campaigns like this and heightened awareness can accelerate our vaccination uptake?
I can actually answer some of that. In fact, what we've been doing is participating in Vaccination Week of the Americas since its inception, and we've used it to create the awareness. And whilst we often haven't vaccinated people during that time, we've used it as a part of the strategy of building confidence with the public, with building the alliances with our partners, our private healthcare providers. We often use it for training and discussions around new vaccines, and these in turn help with the uptake from the client level as well. There have been other promotional ones. We can see from year to year the participation, and so the activities that we do around Vaccination Week in the Americas often allow us to see changes in the uptake, which is why we had the vaccination strategy a couple of years ago, the 2018-2021. And that did realize the results and the improvements that the minister had actually talked about. So we've used it a little bit differently for our context.
Understood. That's very helpful. And that's everything for me. Thank you all very much.
Thank you, Fiona, and thank you for the members of the media for attending, and for everyone else who have joined us today. Minister and Mr. Stein, I invite you both to say some parting words.
Thank you, honey. I'd like to thank those persons that joined me this morning on the announcement of us celebrating the 20th anniversary of Vaccination Week. And we're closing the vaccines to work. And specifically to the mass vaccination program for COVID, thanking not only the Ministry of Health team, but the private physicians and all the other stakeholders that were involved in helping Bermuda reach that WHO target of over 70% of our community. Thanks to everyone who helped participate in that great endeavor. Mrs. Stein?
Thank you very much. I think that I would focus on two things. One is, of course, reiterating the education that we have. There's so many different people that are necessary to make this a success, and a success over the past several years. The second thing is, I think that allow me to underscore the message of this campaign. Have we gone all actually for parents and for a range of persons, parents, and for our children and for ourselves to revisit? Have we gotten all of our shots? Are we all up to date on all the different pieces that we need to be at? And in this respect, I think this campaign provides a great opportunity to know where we are and to get our shots necessary. So thank you very much.
Thank you, Minister, and thank you, Mr. Stein. And that concludes this conference. Enjoy your